Hi everyone, my name's Daryl. Welcome to the Get Shredded with Daryl channel. So I need you to be a little patient with me. I'm going to go into a little bit of context talking about what caused my panic attack, and so you'll maybe understand it a little bit more. So as some of you know, especially regular watchers of my channel, I have a condition called CIDP. It stands for chronic inflammatory demyelinating polyneuropathy. It's really a chronic version of a syndrome called Guillan-Barre syndrome. And basically what the syndrome is it's an immune condition where my immune system attacks the nerves in my body. Typically it's caused by some sort of virus or infection. Your immune system kind of goes crazy, and for some reason it just starts attacking the myelin that lays over the top of your nerves. So obviously I have some issues. With my CIDP condition, it requires me to get an infusion every 3 weeks. Basically, I get injected with other people's antibodies, and it kind of confuses my immune system. It kind of resets it so it stops attacking my own body. But my last infusion, it was a little bit of a difficult one. So what a nurse does is she comes in, and I get home infusion, so it's really nice. So it's very convenient. But basically they come in, and of course you get hooked up to an IV, intravenous line, and they get this thing called a catheter, and they insert it into one of your veins. I guess I'm what they call a tough poke, meaning that sometimes it's a little difficult for them to get the catheter in. They call it flash, and so when you put the catheter in the vein, if there's good flow, there'll be flow of the blood going back out of the catheter into a tube, and that's what they call flash, and so that they know they're in the vein and everything is fine. So she tried multiple times to get the catheter into my vein without success, and so I'll show you that. Get it?
Yeah, we've got some flash. I just would like to see more of it in the chamber here.
First one didn't go, but no pain. That's good.
Try this one more time.
Okay, so I'm stopping the recording. We've had 2 unsuccessful attempts, so hopefully on the third one, with me not recording, we're gonna have some success.
It's too much pressure. Too much pressure.
So hopefully this is the winner chicken dinner.
Too much pressure.
So after her 4th attempt, she finally got a successful flash, and so everything was going well. At least I guess you could say it's going well after getting poked 4 times, but finally it was a successful one. But I think I was a little anxious. You know, I'm a little high-strung anyway. So I got up, and I kind of felt a little bit dizzy, a little disorientated, and when I got up, I had some pain in my arm where the catheter was stuck in, and that's unusual. I mean, usually when they stick the needle in, there's a little bit of pain initially, but then once it's in, you're pretty much all set. So as I got up and I kind of moved my arm around, I got some pain, and so I felt a little flush in my skin. I started sweating a little bit, and but I mean, I sat down and I was okay, and so we were going to start the infusion, but then every time I kind of moved my arm, I got more pain. And I was like, okay, usually it takes more my infusions. It takes about 4 hours for them to do it. So I'm not going to have 4 hours worth of pain in my arm every time I kind of move it just a little bit. And so the nurse was like, oh, okay, I'll pull that out. And so she went ahead and pulled it out. And so then as soon as she did that, I was gone. So let me show you my reaction to the panic attack kind of starting. So I am now in the middle of a full-fledged panic attack. Don't know why. I had a little pain when I got up, when I kind of bent my arm a little bit, and then all of a sudden the room kind of started spinning, and I'm sweating, and yeah, the head feels funny. So yeah, this is not great. Hopefully I'll start feeling a little better here in a second. So for those of you that have panic attacks, you probably know exactly what the situation is and kind of why they happen. Maybe you can't stop them from happening, but basically it's the fight or flight kind of thing that your body reacts to when you're in a situation where you think you might die. And it's your nervous system taking over and basically preparing your body to either fight or flight. And so your heart rate gets elevated, your blood pressure goes up, you start sweating, you're just ready to go. But when that happens and you're really not in that kind of a situation, then your whole body gets out of whack and your brain just goes crazy and literally you think you're gonna die. As I said, your blood pressure gets elevated, your heart rate gets elevated, you start to sweat, you'll have some dizziness. It's just an awful feeling. You'll get tightness in the chest. You really feel like you're having a stroke or a heart attack. And it's the most worst feeling in the world, especially when you don't exactly know what's going on. So a lot of ER visits are for people that have panic attacks. So that's one of the things that doctors sometimes look for. So I have experience with panic attacks. So I used to have panic attacks like 10 years ago. It's a long story, but I got over them. And basically how I got over them is at some point I just realized what they were. And so what I do now, and I actually read this from somebody, I just invite my old friend over for some coffee. I know he's coming. There's nothing that you can do about this old friend coming over. He's just going to talk to you for a little while. So you exchange pleasantries. Eventually, after you've talked to your old friend for a while, he decides to get up and leave. And that's what happens with a panic attack when you don't react and you just relax. You know what's going on. You take it in and you just let it go. And that's basically how I got over my panic attacks. It's just understanding what they are and just learning how to calm yourself down. Sometimes it really helps to go outside, especially if it's like cold outside, and get some fresh air, or just to go outside and kind of take a walk around. My wife used to take me to the ER, so she would drive me to the ER and I would sit there for a little while. I wouldn't actually see anybody in the ER, but I would be in the hospital. Yeah, I was like, if I have a heart attack, I'm right in the right place to be. So anyway, so that's how I deal with them. And you can read up on panic attacks, and there's multiple strategies that you can use. There's drugs that you can take for them, but interestingly enough, the drugs that you take for panic attacks, initially, they actually make the panic attacks worse. So you have to be a little bit careful. So if you have panic attacks, you know what I'm talking about. If you are a GBS, a Guillan-Barre, or CIDP patient, you've probably had so much to deal with in regards to your physical health. You basically go from being normal one day to the next day having your whole life just thrown upside down. People that have the acute version of the Guillan-Barre, a lot of times it'll take either 1 or 2 days for the syndrome to fully take effect. Sometimes it can take hours for the syndrome to take effect, but basically you go from being totally normal one day to basically not being able to walk the next. A lot of times the syndrome, it usually starts in your lower extremities, so your legs, and then it starts rising up. So it'll start in your feet and it starts rising up, and then it can get actually into your lungs, where you need to get incubated because you can no longer breathe. And so, nobody knows when this thing is happening to them. Nobody knows what's going on, and it's just so scary. In my case, I didn't have I guess the really bad version of it. Although my doctor says that I had the Amen variant, which is pretty bad. I've got a lot of nerve damage in both my legs and my arms, but luckily I've recovered quite a bit, but I still have nerve damage. But it's a lot to deal with, both from a physical standpoint and from an emotional standpoint. For me, it was really the most frightening experience of my life. The doctors didn't know what was happening to me. They thought I was on drugs or something like that. They thought I was, trying to get medication in order to get pain relief because I had severe pain in my lower back. But I couldn't walk right anymore. And maybe they thought I was faking, I don't know. But I couldn't sleep. I couldn't sleep for 3 weeks just because of the anxiousness that I felt and the pain that I felt. It was just awful. So I saw a psychiatrist, and eventually I've got some drugs that help with the sleeping, as well as the pain and the nerve conditions that I currently have. But, for any of you that either have Guillain-Barre or CIDP, or any caregivers that care for somebody with this terrible disease, you just really need to support your loved ones and give them all the care and support that you can. And I guess you have physical symptoms, but you also have mental symptoms, and there is lots of things for you to deal with when you have this disease. And so I would encourage anybody that is dealing with this, they don't overlook seeing somebody to help with their mental health, because it's a lot to deal with. And I would go for anybody that is having any sort of anxiety or anxiousness. It's really important to take care of your mental health. So don't be ashamed to go see somebody when you are struggling mentally. So back to my infusion. So after I guess you call it the fourth failed attempt, although I guess she really succeeded, but it just, that catheter wasn't working for me. So after the fourth failed attempt, she got on the line and she called in, she called in for the relief pitcher, I guess you would call him. And so another nurse came by, and she is very familiar with me, and she also had difficulty when she came by. So on her fourth attempt, she finally got that catheter in there, and we were off and running. So that's going to bring up my next topic, perhaps, I'm going to call this my CIDP Guillain-Barre series of videos. That's going to go along with my Getting Shredded with Daryl channel, is getting a port. A couple of my nurses had recommended that I get a port installed or inserted, which basically makes it a lot easier for them to put the catheter in without actually having to get into my veins. And so I talked to my neurologist about it a little bit, and they were worried about infections, but maybe it's time to revisit that. We'll see how it goes. The nurse recommended that the next time I do my infusion, that along with doing hydration, that I get a heat pad or something and put it on my veins. And sometimes putting heat on your veins can kind of soften it up and make it easier to insert the catheter. So that's kind of what she did, is she got a heating pad, put it on there, and then after the heat got to it, then it was easier for them to insert that catheter. So as always, if you got value from this video, please consider liking it, as well as subscribing to my channel. I hope to see you on the next video again very soon.